Welcome to the instruction video of using LiveActive Health Tracker with CHF management. Here on the dashboard I have created multiple widgets with health issues, and I've added CHF here in the blue. To get started, like every other widget, you just click on the C on that widget for the CHF, and now you can look at the details. Here you have the related medications. I pre-populated it with Lasix. You click on the edit to see your list of medications and see what do you use for CHF. In this example, you might click Toprol XL and lisinopril as well. When you click done, those will populate there. To create goals, what we're talking about is symptoms. 0 to 10 scale is a nice, easy one for everyone to remember and work with. And again, talk to your physician and your healthcare team to identify what those numbers mean. So what does a 4 mean? What does a 7 mean? You know, maybe you're very short of breath and swelling happening in your legs and your hands, and maybe that's 7 and above. So you just create 0, 4, 7 in those fields to create your goals. Hit confirm to save it. You add a reading by clicking add reading, and then if you want to look at your readings, I've just pre-populated it in the last couple of days. So for us, in a quick glance, we can tell how good of a control or how bad of a control of CHF do we have. Now when we click on the medications list and we look at Lasix, you click on Lasix, you can see the details here. It's 40 milligrams daily, and we've said the related categories is CHF. You can set reminders again. You can add readings. Again, if you're taking your Lasix and you're taking your medications, click add reading, and then that's when it will timestamp it and see how many milligrams you're taking it. You can click and write a note here. If you're doubling up, simply put 80 milligrams here instead of the 40, and then write took 2 doses. This will help communicate to the healthcare team that you actually had to take an extra dose of Lasix. Click add medication consumed to save that. Again, we can view the recordings here in a simple glance and can see when did you take 80 milligrams, when did you have to double up your dose versus the usual daily dose of 40 milligrams daily. Finally, when we're ready to create a report, you click on report on the bottom. Here I've kind of pre-created it. Again, hit the plus sign to make your report, and we're going to look at CHF by itself in this first example. And again, when you click on the data point, you can see that it is a 3 on a 0 to 10 scale, and then 5 on a 0 to 10 scale. Then here, Lasix of 80 milligrams was taken when it was a 10, and then 40 milligrams of Lasix on 3, which is the usual dose, and 80 again when it was a 9. When you scroll down and look at the raw data, you can see the notes there showing if they're doing okay, they're not as active. It was a scale of 3, and then their Lasix of 80 was taken when the score was 10. If you want them to email, or share it with your healthcare team or print it, simply click and generate a PDF report. And again, it's a very nice graph. Helps us kind of see not only the raw data, but also to take a look at how your symptoms and how your medications have been effective. Now, the neat thing about CHF, and when we give Lasix, we always worry about blood pressure and how it's affecting your blood pressure. Are we diuresing you too much? So CHF and blood pressure might be a report that we can create, and we can, in a snapshot, kind of look at your blood pressure numbers. Again, this is just an example, and I just put in random data just to create the graph. But what you can tell is how are the blood pressure numbers doing with my CHF. So CHF is on the bottom here. The systolic, the top number of your blood pressure, is the topmost line, and then this bottom line, or the middle line in this graph, is the diastolic blood pressure, the bottom number of your blood pressure. But again, it kind of helps us say, okay, the blood pressures are pretty high, and you're doing 80 milligrams of Lasix sometimes, and it's not really affecting your blood pressure. So we actually have some room where we can push the Lasix. And again, you can look at the raw data, and when you're ready to share or print, create a PDF. Now what we have is a list of the medication on the right side of the report. And then we have a nice graph that shows up that we can print out and then look at the raw data. So it's divided by the blood pressure and it's divided by CHF. So now we can see if there's a correlation that exists. It also helps us figure out if we can push the Lasix a little bit harder or maybe substitute the Lasix with a stronger diuretic, etc. So this is how we can use the LiveActive Health Tracker for CHF and blood pressure monitoring. I hope you found this instruction video very helpful. And again, if you have any questions, ask your physician, your healthcare team, or email us at info@liveactivepc.com. Thank you very much.